born and raised in LA, grew up in a predominantly Mexican-American community, so on the east side of Los Angeles. Early on, I wanted to be a Catholic priest. I look back and I think part of that was because the community that I grew up in, the people that I saw that were educated, respected, were leaders in the community, were the Catholic priests in our community. Kind of inspired me. Probably would have been the same if I had, Latino physicians in the community, but we didn't have that in the community. It's sort of the idea, you gotta see it to be it. And I didn't see that. I ended up going to a community college locally. So I took chemistry and biology. And the only other people in community colleges that take chemistry or biology are pre-med, pre-pharm, pre-nursing. They're all in the health sciences. So those are the people that I would study with and hang out with. Some of the older students that were pre-med kind of took me under their wing. So I went to a conference with them and kind of the ball started rolling from there. I met my first mentor there, a Latino physician. So you see it to be it. That really kind of got me thinking, yeah, I can do this. So I got accepted early to USC, UCLA, and I applied to some other medical schools in California. But my mentor, Dr. Flores, said, hey, I think it'd be a good idea for you to get out of California for a while and expand your horizons a little bit more. He goes, well, why don't you apply to some of the Ivy League schools? I said, well, I'd go to Harvard if I could get in. My first encounter with the Corps was actually in medical school. I was a first-year student. I looked on the bulletin board and there was something from the National Health Service Corps, a summer program that they had at the time called the Health Promotion Disease Prevention Program. I said, wow, that's interesting. And I looked at it some more and I figured out I could actually go back home to LA to a community health center and do my health promotion project there. So I ended up, signing up and going back to California, going back to Los Angeles. That was my first contact with the National Health Service Corps. And got into the community health center world, I realized that there was a connection between the work of the National Health Service Corps and the community health centers. I started working with our medical staff there, trying to make sure that they understood that there was an opportunity for them to apply to loan repayment programs, working with HR to make sure that we always, made it clear to new candidates that loan repayment was an option through the National Health Service Corps, and it became a recruitment tool for us, to help bring new physicians into these health centers. So it was really a blessing. The National Health Service Corps as a resource is invaluable. It is one of the most important and most effective means of recruiting people to come and work in some of these communities. Some of them are very difficult communities to work in. Rural communities, inner city communities, where it's very difficult to get physicians and other clinicians to come in. The Health Service Corps, as a resource, they're the ones kind of making that connection between these communities and providers, clinicians that want to do this kind of work. There are folks in medical school who have that calling, that sense of mission and duty. This is a natural way to connect them with these health centers. Medical school costs are tremendous, exorbitant. And I think for a lot of medical students, they see some limitations to the career paths that they can take. The Health Service Corps says, no, you can do that work. Here's a way that we can help you do it and fulfill that calling that you have. And I think this is a great opportunity to bring these clinicians back to these communities so that young kids can see them, other community members can see them and realize that, yeah, this is something that's achievable for us or for my children. I think it's going to continue to be tremendous, hopefully for at least another 50 years, if not more. But I think the Corps' triumph is actually the well-being and health of the American population. In my heart, I think medicine is a commitment to service. So it's a mission to service. I still say, medicine is a vocation like the priesthood. It's a calling to do something, and I think medicine is the same thing. It's a calling to something greater than yourself.